Vancouver's downtown east side is often shown as ground zero of the opioid crisis. But the emergency is widespread. In the past decade, there have been over 2,400 overdose deaths in the Fraser Health Authority, more than in any other provincial health authority. And that's put pressure on emergency departments like the one at Burnaby Hospital.
Hospitals such as this were built in the 50s and 60s obviously have served us well. But if you look at those facilities in general, they tend to be interior, no natural light, and tend to reflect the values and the views of mental health and addictions at the time.
Dick says that's about to change with the opening of a new care zone for patients with mental health and addiction issues, where calm and comfort are the priority. It will have a separate entrance from the main ER and 3 private exam rooms.
We're not just putting a nicer space here, but adding services. It's going to make a big difference.
He says he'd like to see separated mental health and addiction zones in ERs across the province, something that St. Paul's in downtown Vancouver has been doing for almost 20 years.
The most agitated, disoriented, disruptive patients come in, on crystal meth, on other uppers and stimulants, and they're very difficult to manage. They have no insight. They can be violent to themselves and towards the staff.
Their emergency department is one of the busiest overdose ERs in Canada. Calla says separated care means better treatment for addictions patients and overall better care for all emergency patients.
It's a form of compassion to give these people, as I said, a safer, more dignified place to be cared for. And at the same time, you do have to protect the rest of the patient populations at times from disruptive, potentially violent patients.
The new specialized zone at Burnaby Hospital will officially open tomorrow. Fraser Health expects it to help more than 4,300 patients a year. Ava Yugwen-Senge, CBC News, Vancouver.